Nicole State nursing student, and I'm going to be conducting a health history exam today. So we're just going to be discussing your previous and your current health, and as long with your family members.
Okay.
Can I get you anything before we begin?
No, I'm okay. Thank
Okay.
you.
So we're going to go ahead and start then. How old are you?
21.
Okay. And what is your birth date?
3/15/99.
Okay. And where were you born at?
Indianapolis, Indiana.
Okay. And what do you identify your gender as?
Female.
And are you currently married?
No.
Okay. And what would you say your race is?
Caucasian, white.
Okay. And what is your occupation?
I'm a student and I also host at a restaurant.
Okay. So what is your major health concern at the time? What brought you in?
I just wanted to get a checkup.
Okay. And how do you feel about seeking health care?
I feel comfortable with it.
Okay. And how would you describe your general health? Are you mainly healthy?
I'd say I'm fairly healthy.
Fairly healthy? And on a scale from 0 to 10, with 0 being no pain at all and 10 being the worst pain you've ever felt, how would you describe your pain?
A 0.
A 0. Okay. And so do you have, now we're going to go look at your past health history. So as a child, did you have any illnesses like the flu, strep?
Yeah, I had the flu and strep.
Flu and strep? Okay. Did you have any other childhood illnesses?
No, I was pretty healthy as a kid.
Okay. So now we're gonna go through your immunizations. Have you had like your flu shot, your chicken pox, your Tdap?
Yeah, I've had all of those.
Okay. Have you had HPV or rubella? that you
Yes.
know of? Okay. And measles and mumps or hepatitis A or B?
I know I definitely had hepatitis. I'm not sure about the other ones.
Okay. Okay. And then in your adulthood, have you had any illnesses? This could be like physical, mental,
Anxiety.
anxiety. Okay. And have you had any surgeries or hospitalization or operations?
No, I had a scope down my mouth and my stomach to
Okay.
check for stomach ulcers.
Okay. And have you had any accidents or major injuries?
No.
Have you noticed any like prolonged pain or pain patterns?
No.
Okay. And do you have any allergies or reactions that you know of?
No, none that I know of.
Okay. And are you currently taking any medication?
No.
So now we're going to go through your family history. So this will include the 3 generations. So it'll be you and your siblings, your parents, and your grandparents.
Okay.
So do you know of any diseases that run in your family? This could be like diabetes, heart disease, cancers.
Yes, I know high blood pressure, and both of my parents have high blood pressure.
Okay.
My grandma on my mom's side has arthritis,
Okay.
and my grandpa on my mom's side had lung cancer.
Okay. And you said your grandpa had the cancer?
Yeah.
On your mom's side?
Yes.
Okay. Is that all you can think of for?
Yeah, that's all I can think of right now.
Okay. So now we're gonna go through your systems, and I'll just be explaining everything as we go through it.
Okay.
So we're gonna start with your skin, hairs, and nails. Have you noticed any changes in your nails or any like freckles or moles?
No.
Okay. Have you noticed any dry skin, itchiness, anything like that?
No.
And any bruising that you can't really explain, or any hair loss?
I just bruise kind of easily, so sometimes, and then like hair loss only if I'm really stressed out.
Okay. Okay. And for your head and neck, have you noticed any dizziness or loss of range of motion, so like tightness when you try to move your neck?
I just get kind of dizzy when I stand up sometimes.
Okay. And your eyes, do you wear any contacts or glasses?
I have glasses, but I don't wear them.
Okay, and when was the last time you got those checked?
About a year ago.
Have you noticed any like discharge or redness or swelling of your eyes?
No.
Okay. And for your ears, do you have a history of ear infections?
No.
Did you have tubes as a child?
No.
Okay. Have you noticed any pain or redness or swelling on your ears?
No.
Okay, and have you noticed any like discharge or ringing in the ears?
Sometimes I get ringing in my ears.
Okay. Are you exposed to loud noises often?
No, I'm not.
Okay. And so now we're going to move to the mouth, nose, and your sinus area. So have you had any discharge or any like cold-like symptoms?
No.
No? Okay. Do you get frequent nosebleeds?
Only in like the fall, winter when the weather's changing.
Okay, so when it's like colder and drier?
Yeah.
Okay. Do you get allergies?
No.
Okay. And have you noticed any like bleeding in your gums or tooth pain?
No.
Okay. And is there any pain or difficulty for you to swallow?
No.
Okay. So now for your like lungs, do you have a history of lung disease?
No, not personally.
Personally? Okay. Have you felt any chest pain or wheezing or anything like that?
No.
Have you noticed a shortness of breath or a persistent cough?
No.
Okay. Have you noticed for your heart any heart palpitations or pressure on your chest?
No.
Okay. Have you ever been diagnosed with anemia?
Not officially, but
Okay.
I have symptoms.
What symptoms would you say you have?
Dizziness, I'm cold all the time, and I have tingling in my arms and legs.
Okay. Have you noticed any discoloration of your hands or feet?
My feet turn purple sometimes.
Okay. And have you noticed any various veins or varicose veins?
No.
Okay. And then for your stomach, have you had any stomach pain or like nausea, vomiting, diarrhea, anything like that?
No.
Okay. Have you noticed a change in your appetite?
No, not really.
Okay. Have you like a little bit or
I'm just always hungry.
always hungry? Okay. Do you have arthritis or gout or anything like that?
No.
Have you had any like muscle spasms or cramping in your muscles?
No.
Okay. Do you have any back pain?
No.
And do you use any assistant tools like a cane or a walker?
No.
Okay. And then for your neurological, have you had any fainting or seizures?
No.
Okay. Have you noticed any memory loss?
No.
Have you had increased nervousness?
Sometimes.
Sometimes? Okay. Have you had any depression?
No.
Okay. And have you noticed any hallucinations or any other mental illness or issues?
No.
Okay. So how would you like describe your typical day?
I wake up and I drink my morning coffee.
Okay.
I'll watch TV, then get ready for the day for whatever I have to do. I'll do homework, watch more TV, eat, talk to my friends, shower, and go to sleep.
Okay. Are you currently comfortable with your current weight?
No.
Would you want to gain weight, lose weight?
I'd like to gain a few pounds.
Okay. And how would you describe your diet? Like, what does it consist of?
Mainly fast food and quick and easy meals like in the microwave or frozen dinners.
Okay. Would you say that you're often active?
No, I'm rarely active.
Active, okay. Do you stretch ever?
No.
Okay. Um, and how many hours of sleep would you say you get a night?
Probably anywhere between 7 to 9 hours on average.
Okay. Do you take naps?
No.
And do you use any medication or sleeping devices to help you fall asleep?
No.
How would you describe your eating habits?
I probably eat like 4 full meals a day at least, and then 2 or 3 snacks sprinkled in there.
Okay. And do you usually prepare your own food or does someone else prepare it for you?
I usually prepare my own food.
Okay. And do you have any food allergies that you're aware of?
No.
Okay. And do you consume caffeine?
Yes.
And how much would you say?
Probably like 1 large cup of coffee or 2 at least every day.
Okay.
Maybe an energy drink.
Okay. Do you have any problems with like your self-esteem?
Sometimes.
Okay. And do you care for your hygiene often, like brushing your teeth, bathing?
Yeah.
Okay. And how often would you say you brush your teeth?
Twice a day.
Okay. And what about showering or bathing?
Usually every day.
Okay. So are you involved in any like clubs or teams or organizations?
No.
Okay. Do you attend any social events?
I hang out with my friends, but I don't go to any formal social events.
Okay. Do you get along pretty well with like most of your family members?
Yeah.
Okay. And do you have regular contact with friends and family?
Yeah.
Okay. And do you have people that you can go to if you need support?
Yeah.
And who would those people be?
My parents, sisters are my friends.
Okay. Okay. Does religion or spirituality play an important role in your life?
Not really.
Okay. Are you part of a religious or spiritual community?
Kind of. My family we're Catholic and we go to church, but when I'm not at home, I usually don't go.
Okay. So when you're like in school?
Yeah.
Okay. And do you have any religious or spiritual issues that you would like to discuss with me today?
No.
Okay. And so what's your highest level of education?
So far, a junior in college.
Okay. And what school do you attend?
Ball State University.
Okay. And do you work?
I do work, yeah. I work as a host at a restaurant.
Okay. And how would you describe your like job?
I mainly just greet people and seat them, and I also clean off the tables.
Okay. Okay. How often do you usually work?
Probably once a week on average.
Okay. And would you say that your social life, your work, and your school life are all balanced?
No.
Which one do you think out of the 3 is taking up the most time?
Probably school.
School. Okay. And do you feel like you're currently under a lot of stress?
Yeah.
Yeah. And what would you say like the main factor of that stress is, if there's a main factor?
Just school in general.
School. Okay. And do you have any stress coping mechanisms that you use?
Yeah, I like to watch TV a lot or eat.
Okay. And do you think that those stress mechanisms are effective?
Yeah, somewhat.
Okay. And so now we're going to move on to your environment. So how would you describe your environment?
I feel pretty safe and comfortable.
Safe and comfortable? Okay. Do you have access to transportation?
Yes.
And do you have your own car, or do you take like a bus, a train?
Yeah, I have my own car.
Your own car? Okay. And are there any hazards in like your home, your place of work, or school?
No.
And do you have adequate utilities in your home?
Yes.
Okay. Alright, so that concludes the health history exam. Can I get you anything before I leave?
No, I think I'm okay.
Okay, well thank you for allowing me to ask you all this and for being a great patient. If you need anything, just let me know.
Okay, thank you.